Hello everyone, this is Arun Kumar, oral maxillofacial surgeon from Sri Balaji Dental College and Hospital. Here we are going to discuss about the maxillofacial trauma and its emergency management. Maxillofacial trauma definition. What is the definition of a trauma? Any injury such as a wound to a living tissue caused by an extensing agent is known as a trauma. When do we call a trauma and a maxillofacial emergency? Maxillofacial emergency is a situation that requires a early management and may complicate affected patient's life by affecting his face, brain, spinal, cervical spine, and airway. Trauma or injury. Facial trauma is one of the main reasons for maxillofacial emergency. Proportionally, male are more prone for trauma than the female, 2:1 percentage. The facial trauma may associated with traumatic brain injury in 15 to 48%. Facial trauma. It may result from interpersonal violence 52%, RTA 16%, sports injury 19%, fall 11%, and industrial accident 2%. Injuries. Maxillofacial injuries are two types: hard tissue injury and soft tissue injury. Hard tissue injuries are injuries fractures of upper and middle third and lower third or mandible fractures, displacement, dislocation, dental alveolar injury, tooth fracture or tooth eversion. Fractures. Definition: a complete or incomplete breakage in continuity of a bone resulting in excessive application of a force. Fractures of facial skeleton. Upper third above the eyebrows involves the frontal sinus, supraorbital ridge. The middle third above the mouth, leaford 1, leaford 2, and leaford 3. Lower third is in mandible. Fractures of upper third of face. Nasal fracture, naso-orbital ethmoidal fracture, frontal sinus fracture, zygomal fracture, maxillary fracture, and orbital fracture. The fractures occurring in upper third of face. Fractures occurring in middle third of face. Everyone knows leaford 1, leaford 2, and leaford 3. Lower, lower third or mandible fracture. Body symphysis, angle, condyle, and subcondyle, and coronal process. General signs and symptoms: swelling, pain, drooling, tenderness, bony discontinuity, laceration, limitation in mouth opening, ecchymosis, fractured and subluxated luxated teeth, bleeding from the mouth. Soft tissue injuries are abrasion, laceration, contusion, hematoma, incised wound, penetration wound, crush and gunshot injuries. Abrasions. Abrasion caused by a frictional violence due to the friction between an object and a surface of a tissue. It is presented as a raw bleeding area. The wound is superficial and denuded at the epidermis, occasionally involve the deeper layers. The abrasion involves the terminal nerve endings and may nerve fibers, and it is quite painful. Abrasion may be contaminated depending upon the surroundings. Abrasion treatment. Thorough cleaning with the profuse saline irrigation, removal of foreign material, gently scrubbing with the soft brush to remove the sticky material and prevent tattooing. Use of a surgical soap if required to be done prior to the dressing. Topical application of antibiotic ointment with compression dressing promotes a good healing. Superficial abrasion can be covered with the topical antibiotic application and left open. Slowly, the crust of a dried blood and serum will form a scab and it will fall as healing takes place. Contusion. Contusion is caused by a blow or a fall against a hard or blunt object. The blood extravasates in the subcutaneous or submucous tissue, leading to the blushed area of bruise. Subcutaneous bleeding is itself limiting. This is without a break into the soft tissue surface. Discoloration of a skin or mucosa causes ecchymosis. The important for diagnosis and the search for an osseous trauma is mandatory. Treatment for condition. Application of ice pack will help to stop further extravasation of blood. An easy bandage may wrap around the bruise made to support the area out and decrease the swelling. Hematomas. Hematomas are localized collection of blood in subcutaneous tissue or intramuscular or submuscular space. It is deeply seated on or superficial. It can be associated with fracture or rupture of vessels or vessels. Careful examination may be repeated, and the X-ray examination is essential for proper diagnosis and treatment. Treatment for hematomas. Most hematomas are reabsorbed. Persistent hematomas may require incision and drainage. It not be aspirated as the blood is partially clotted. Antibiotic cover should be given prior to the hematoma from getting infection. Lacerated wound. Lacerated wound are more frequent type of a soft tissue injury. Here, the tearing of a mucosal tissue or skin is due to the vehicular accident, low velocity missile pellets or bomb splinters. The margin are contused and lacerated in the deep wounds. The muscles are also lacerated and devitalized. There may be associated injury to underlying vessels, nerves, and bone. The wounds are usually highly contaminated with dust, mud, grease material, and bone splinter, etc. The treatment for lacerated wound: thorough cleaning, minimum debridement, removal of foreign bodies, and the proper suturing as early as possible should be done. The closure should be done in multiple layers: muscle, epidermis, dermis, submucosa, and mucosa closure. Incision wound. Incision wound are caused by a sharp cutting object such as a knife, dagger, glass piece, tin, etc. Treatment: cleaning, exploration, and bleeding should be stopped. The wound closure by the primary intention. Penetrating wounds are punctured wounds caused by the pointing object like a knife, bullet, bomb, splinter. Careful clinical examination and other investigation are required. Crush injuries. Crush injuries is caused by the road accidents and mechanical accidents. It damages the damage to the skin, nerves, blood vessel, muscle, bone, and is also seen. Treatment for crush injuries: tetanus shot will be necessary as well as antibiotic. Immediate medical attention is required. In serious crush injuries, in which the compartment syndrome has already set in or in inviable, immediate surgery will be required to eliminate the pressure on muscles and nerves. Gunshot injuries. It is really a penetrating wounds, but are classified separately because in extensive of a wound and special problem arise during their management. They are subclassified as penetrating wounds, performing wounds, and aversion. Emergency management of a trauma patient. Advanced trauma life support, are commonly abbreviated as ATLS, is a training program for the medical providers in management of acute trauma cases developed by American College of Surgeons. ATLS overview: triads, primary survey, resuscitation, adjunct to the primary survey, secondary survey, adjunct to the secondary survey, definitive care. Triads: the process of categorizing victim or mass casualty based on the need of treatment and resource available. Goal: to provide avoidable death, to provide initial treatment in a minimal time. Primary survey: it is a first and important key part of ATLS, includes A, B, C, D, E. A means airway maintaining and spine protection. B, breathing and ventilation. C, circulation and hemorrhage control. D, disability. E, exposure. Airway maintenance. Factors that may compromise the airway. According to Dixon et al., there are 6 specific situations associated with maxillofacial trauma which has adversely affect the airway. Number 1, posterior and inferior displacement of a fracture of maxilla parallel to the inclined plane of the base of a skull may block the nasopharyngeal airway. Number 2, bilateral fracture of anterior mandible may cause a fractured symphysis and the tongue to slide the posterior and block the oropharynx in supine patients. Number 3, the fracture or exfoliated teeth, bone fragment, vomit, blood, and secretion as well as a foreign body such as denture, debris, and sharp shrapnel may block the airway anywhere along the oropharynx and larynx. Number 4, hemorrhage from the distant vessel in the open wounds or severe nasal bleeding may complex blood supply of nose may contribute to airway obstruction. Number 5, soft tissue swelling and edema because of a trauma to the head and neck may cause delay the airway compromise. Number 6, trauma of larynx and trachea may cause a swelling and displacement of a structure such as epiglottic, adenoid cartilage, and vocal cords, and therefore increasing the risk of cervical airway obstruction. Airway maintenance. Head tilts in lift maneuver. Oropharyngeal toileting by digital exploration using a cotton swab, suctioning the nasal cavity, oral cavity, and throat. Control the tongue by tongue suturing. Temporary stabilization of a fracture. Mouth-to-mouth breathing. Endotracheal intubation. Airway maintenance is also done by jaw thrust and surgical tracheostomy and cricothyroidectomy. Spine protection should be done with the patient who has a spinal injury too. Breathing and ventilation. Aim is to identify and manage the 6 life-threatening thoracic conditions such as airway obstruction, tension pneumothorax, massive pneumothorax, open pneumothorax, failed chest segment with pulmonary contusion and cardiac problems. Circulation and hemorrhagic control. If evacuation time is less than 1 hour, surgical intervention should be done after establishing the airway and breathing. If evacuation time is greater than 1 hour, a fluid line should be established first. Usually, crystalloid solution are preferable. Blood, blood is drawn and sent for grouping and cross-matching. As soon as possible, blood transfusion is started. Vital parameters are monitored. Antibiotic and analgesic anti-tetanus protection should be given. For speed recovery, high calorie, high protein diet should be taken. Nasogastrial feeding is in severe cases and vitamin supplements should be given. Secondary survey, head to toe evaluation, GCS, physical examination, lab examination, and histories of ample. Ample means A for allergies, M for medication currently used, P for past illness or pregnancy, L for last meal, and E for event associated or environmental related to injuries. Later on, definitive care should be given for the patients. And thank you.